Hi, my name is Gabriel. So today I'm going to show you guys how to ambulate with a gait belt, with a cane, and with a walker. And as always, I have my lovely assistant, Miss Brittany, with me. All right. So for this, you're going to need your gait belt, your cane, your walker. Your patient, they should be sitting in a seat, right? So with this one, of course, like with all of our skills, we're going to knock, knock, knock. Hey, Miss Brittany. So you've been sitting in that chair a little bit. You ready to head back to your room? All right. So I'm going to wash my hands. This is not a gloved skill. All right. I'm going to make sure I have my gait belt. All right. Now, if you've seen our bed to wheelchair transfer, we do our gait belt the exact same way. Do our gait belt the exact same way. So with this one, I'm going to make sure I know which side is my patient's strong side and which side is my patient's weak side. We're going to say that Miss Brittany's left side is her weak side, right? I want you to make sure that this gait belt goes around. I never take it over the top of her. I just feed it through around like I'm giving her a great big old hug. Okay, so it's gonna look something like this. Maybe there it is. All right, now I want to make sure that that gait belt is right under chest line. You have about an inch and a half, 2 inches of play there. We don't want it too high because we don't want to squish her chest, and we don't want to make it too low because we don't want it on false or floating ribs. That could hurt that patient. Excuse me. So we're going to feed it through teeth first. Feed it through the teeth first. Tighten it, get it nice and tight. We don't want that metal piece sitting directly in the middle of our patient. We want it just off to the left or the right a little bit, okay? And then once we get it tightened up, we're gonna check, make sure got about 2 inches worth of, or 2 fingers worth of give. Perfect. Tighten it down. And then with all of our tail, we're just gonna tuck it in between. All right. Now from here, I'm gonna square it with my patients. I want my toes with her toes and my knees with her knees aligned up. They don't have to be touching, but they do want to be lined up parallel to one another. All right, I'm going to do a sitting squat. I'm going to have Miss Brittany reach to the back and push herself off of that chair. Okay, we're going to do this on the count of three. 1, 2, 3. I just pull her straight towards me. Now from here, I stand on her weak side because I'm giving her that support, and we're going to walk. And we're walking, and we're doing a nice little loop. And look at us, we're almost back to the room. Walk, walk, walk. Now, when it comes to putting my patient back down, I'm going to line myself up with them. Put hands on both sides once again. I'm going to have her take little steps back until she feels that chair on the back of her legs. Can you feel that chair, Miss Brittany? All right, now I'm going to have her reach back with her strong hand just to give her a guide for where she's going. And we're going to sit on the count of 3. 1, 2, 3. Fantastic. Now, after that, all I'm going to do is I'm going to take that gait belt off, wash my hands, record and report. But let's say my patient has something like a quad cane. So I'm going to go through all the same steps, right? Wash my hands, put that gait belt on my patient. We're going to stand up on the count of 3. Ready? 1, 2, 3. Now, anytime we have a cane, right, an assistive device, we're going to put this in the strong side. So I'm going to give that to Ms. Brittany's strong side, and I'm going to be support for her weak side, okay? And we're going to walk. Great. Great. Look at you. All the way around, almost back to that chair. Now that we're here, gonna line her back up. Gonna let go back until her legs are touching. I'll move this cane out of the way because I'm gonna have her reach back for that chair. And we're gonna sit down on the count of 3. That's gonna be 1, 2, 3. Easy enough, right? To finish that off, we're going to take off that gait belt, wash our hands, ask our patient if they need anything, all right? Now, if our patient is using a walker, it's going to be very, very similar to when they were using a cane. First thing I'm going to do is I'm going to want to get that walker set up. All right. I'm going to have my patient prepared. She's going to reach back to push herself off, and we're going to go on the count of 3. 1, 2, 3, and we're up. All right, stay right there. I'm just gonna bring that walker to you. All right. And I'm still going to stand on her weak side just in case. All right. You go ahead and start your walking. Perfect. Perfect. All the way back around. Look at you go, Miss Brittany. All right. Now we're going to move that right out of the way so that I can get square with her again. I'm going to have her reach back with that strong arm. As you can tell, she's prepared for this part, right? We're going to sit down on the count of 3. 1, 2, 3. Fantastic. And like I said, to take off that gate, but we're going to undo everything. Pull that gate right off. Pull that from around her. And we hang this in our patient's room, put it back where it usually belongs to our patient. All right. At that point, I'm going to ask, all right, Miss Brittany, is there anything else I can do for you today? Fantastic. Well, before I get out of here, I make sure that she's settled. I make sure she has water beside her bed. Make sure that she has her call light, right? If she's sitting in the chair or something like that, I wash my hands. I record and report.